2 anti-inflammatory drugs for your heart that will work to reduce your risk of heart attacks. I'm Dr. Evan Levine, board-certified cardiologist. If you enjoy my videos, like, share, and follow. Stop looking for the next miracle anti-inflammatory drug for your heart. It's not Motrin, and it's definitely not prednisone. In fact, those can increase your risk of a heart attack. And while the medical world was buzzing about colchicine, well, the latest low-doco trials weren't the home run many hoped for. Even those mouth scans looking for dental inflammation to treat heart disease, no, not helpful. The most powerful anti-inflammatories for your arteries are drugs you already know, but you've been told they're for something else. Now, everyone thinks statins just lower your LDL, but their real superpower is pleiotropic effects. Let's look at the Jupiter trial. They took patients with normal cholesterol but very high levels of high-sensitivity CRP, a marker of inflammation, and the results? Rosuvastatin significantly reduced the risk of heart attack and stroke. It wasn't just about the fat in the blood, it was about cooling the fire in the vessel wall. Statins stabilize plaque so it doesn't rupture, and that is an anti-inflammatory success story. Now, second, and this is a game changer, the GLP agonists, the GLP-1 agonists, the Zepbound, the Ozempics, you know them as weight loss or diabetes drugs, but look at the SELECT trial. These drugs drove CRP significantly down by melting away inflammatory fat, specifically visceral and epicardial fat that sits right against your heart, pumping out nasty cytokines. And when you remove that toxic fat, you aren't just losing weight, you're putting out a chemical fire that leads to coronary disease. This is why we're seeing significant reductions in cardiovascular events. The bottom line, we spent decades looking for a pure anti-inflammatory, but the winners, they're right in front of us now. One stabilizes the plaque you have, and the other removes the fuel that creates inflammation in the first place. I hope that helps.